Okay, hi everyone. So I'm Dr. Tanvi Thapar. I am from Jaipur and I'm a dental surgeon. I own three clinics here, private clinics, and I am a third generation dentist. My grandparents started a Thapar Dental Clinic here in Jaipur, and then my parents are also dentists, and then me and my brother, we are the third generation dentist here. You can check out our clinics on our website, which is thaparentalclinic.com. We also have a presence on Instagram and Facebook. You can check out my personal page, Dr. Tanvi Thapar, and my clinic page as well. In the end of the session, you have any queries, any questions, you can always feel free to mail it on the Baby Chakra platform, or you can send it to me on my Facebook or Instagram page. So, yeah, that's a little about me. Let me start the session. So, today our topic is how can we take care of toddler smile, toddlers, or I'll say even children. With what are the certain things we need to see when we talk about child dentistry? Common problems which parents face, or common dental diseases seen in children, how we can prevent those diseases, and so we'll be talking about everything. So let me start by the basics. One very common myth and one very common question which I'm asked is that is it necessary to treat milk teeth? A lot of patients come to me and they're like, ये तो कच्चे दांत हैं, यानी गिर जाएंगे, बच्चों के दांत हैं, permanent आएंगे, so do we need to treat the milk teeth? Yes, the answer is yes, you have to treat milk teeth, because let's talk about the importance of milk teeth first. The first and foremost is that milk teeth are your guide to, they act as a guide for your permanent teeth. Milk teeth will tell the permanent teeth, okay, this is where you're supposed to come. So, if the milk teeth fall prematurely, the permanent teeth will not know where they have to go, which results in a malocclusion. Malocclusion is जो दांत थोड़े आगे पीछे हो जाते हैं, or later when you need that braces wala stage, that is when your milk teeth have not your permanent teeth have not erupted properly. So milk teeth act as guide for your permanent teeth, just first. Second is your milk teeth start falling when the child turns 6 years old, and they keep on falling till he's 11, 12. Now, if you do not treat a milk teeth, suppose milk teeth has caries and the child is in pain, and you think कि अच्छा नहीं, it is a कच्चा दूध का दांत है and ये तो गिर जाएगा, and you don't get it treated, the child will be in severe pain and he is going to stop eating. Now, which in turn affects his growth and his health. So don't think that the teeth is going to fall, because the teeth will not fall till he's 11, 12 years old. Till that stage you have to maintain the milk teeth itself. So don't think that milk teeth are दूध के दांत गिर जाएंगे, so we will not get it treated. Don't think that, because if the child is in pain, he will stop eating food. He will not tell you that the pain is there, because usually children are scared of telling the adults. So they will not tell you, and it's going to affect in his overall growth later. So these are two very big reasons that okay. And the third is that children start going to school, and sometimes what happens, their front teeth, सामने वाले दांत are not, because of caries, they turn black or they break. uh, it affects the confidence of the child, because if when he smiles and he has black teeth in the front, they don't look good, other kids start making fun of you, so your confidence really goes down. So I'll say, even for, it's the same in adults. Like in adults also, if you're if you don't have a good smile, you are not very confident in talking to people and mixing with people. So it's the same with adults also. So that's why, that for your personality development, a good smile is very important. So yeah, I think this is first question, why why you should get milk teeth treated. This is I think I've covered all these points. Now let's talk about when is the right time to start brushing, or start when is the right time to start uh, maintaining your oral hygiene. The right time to start maintaining your oral hygiene is since birth. Since birth, children don't have teeth, still you need to clean the gum pads. Now, how you do it? You have to take a sterile gauze, wrap it around your finger, and usse just एक बार wipe करना है पूरा. So you have to wipe the gum pads, you have to wipe the cheek, the tongue, everything. This is your first brushing. Then once the first teeth erupts, you can start using a small baby brush which is soft. So you have to start brushing from day one. Now, one very, very common mistake which parents make is that once a child takes his night feeding, he sleeps immediately. Now, the milk remains in the mouth. The last drop of milk remains in the mouth. Milk is sweet, which will cause cavities. So, you must have seen a lot of kids at a very young age have a lot of cavities. That is because the milk has remained in the mouth overnight, which has led to bacteria causing cavities. So, whenever the child is taking a night feed, make sure that you're putting 1 spoon of water in the mouth so that the last thing in the mouth is water and not milk, which is sweet. So this is one very common mistake I've seen what parents make is that the child will take night feed and sleep off. So don't let the child sleep with milk in the mouth. Just put a drop of water. And as far as the brushing technique is concerned, or the toothpaste, a lot of patients ask me how much toothpaste should the child take. The right correct amount of toothpaste is just one pea size. It has to be this small, and the brushing motion has to be circular. The child has to brush in a circle motion on the teeth and the gums. That is the right method of brushing. Now, this is how you maintain your oral hygiene for the children. Coming to some very common diseases, which are dental diseases, which are seen in children. First is your dental caries. Dental caries is जिसको हिंदी में भी सी के कीड़ा लग गया है दांत में. Dental caries is if you see something black on the teeth. Now, caries at a very early stage will not pain. Caries is not painful if it is at an early stage. If you do not get it checked and you do not get it treated at that stage, it will keep on spreading. And once it reaches a certain level in the tooth, then the child will have pain. Now that is when we can't do a simple filling. The teeth has to be either it goes in for a root canal. Children also have a type of root canal, or you have to remove the tooth if it's very broken. So do not let the that small black dot reach a stage where the child is having pain. The moment you see ki acha nahi, something is there, you see some break in the teeth, or you see a black spot, go to the dentist and get it checked there and then. So the first is dental caries. Second is the children complain of swelling of gums. It is not very common in children, but there are reasons why he might have swelling. If the kid is not brushing properly, or if there's a new tooth erupting, then he might complain of some itching or swelling. Now, the swelling of the gums can be maintained by a proper oral hygiene, a proper cleaning. In adults, we suggest that every once in 6 months you should get a professional cleaning done. In children, you need to brush properly. If there are a lot of deposits, then yes, you might have to get a cleaning done for the child as well. Now, the third is a trauma to the teeth. We all know kids love playing, they keep falling down, and I've seen so many times that the tooth comes out, the entire tooth comes out. It is very important to know these things, that if your child has had a trauma and the tooth has fallen off, the entire tooth, you need to preserve that tooth. The tooth is vital in the sense that it is alive for the next 24 to 48 hours if you preserve it, say in milk or in salt water. Milk is a better. Okay, put the tooth in the milk and go to the dentist as soon as possible, because we can reimplant that same natural teeth. Now, reimplanting a natural teeth is always better than going in for something artificial. So, if by any chance your child has had a trauma and the tooth has fallen off, please preserve that tooth in milk and bring it to the dentist as soon as possible. We will disinfect it and we can reimplant it. So, this is one very common thing which the parents face. And once your child grows older, then the last thing is your braces, which is दांत थोड़े आगे पीछे हैं या ऊपर नीचे हैं. To the right time to get braces is when all your permanent teeth have erupted, which is around 12 13 years of age. Once all the permanent teeth are erupted, then the child can go for braces. Nowadays, we have a lot of options in braces. We have metal braces, we have ceramic braces, we also have invisible braces. So, the braces treatment is not very painful how it used to be in earlier time. It's become very comfortable. So, yes, there are multiple options now. And yes, I think I've covered kind of everything. If you have any questions as parents, please feel free to ask me, and I am here and happy to solve all your queries. Okay, so one question: why does your child need to see a pediatric dentist? Again, how I mentioned that once the first teeth erupts, that is when the oral hygiene regime starts. A dentist will be able to guide you. Will be able to guide you in a proper manner about your how to maintain the hygiene, because if you're maintaining a proper hygiene, your child might never have caries. And there are certain sometimes the teeth are aligned in a way that they stop the growth of the jaw. So the dentist will we use some appliances and we correct the alignment of the teeth so that there's proper growth of the jaw and face takes place. Now all these things can only be guided by a pediatric dentist. So yeah, that's the reason you need to keep consulting. How you consult your pediatrician for your child's health, for your teeth, you need to consult a pediatric dentist. Okay, so at what age should my child start using a toothpaste, and how much should it be? Okay, so the toothpaste you can start the toothpaste when your first teeth erupts, you can start using the toothpaste. The amount of toothpaste is just a pea size. Don't use too much of it, but just a small pea size of toothpaste is enough. Before that, when the teeth have not erupted, you can just take a sterile gauze, wrap it on your finger, and probably take a little salt water and clean the gums and your cheek and tongue with that. But you can start using toothpaste as soon as your first teeth erupts. Yes, not nursing will not cause caries. The question is that is it true that nursing causes tooth decay? See, nursing does not cause tooth decay. There's something called as nursing bottle caries, which is, as I mentioned, the last drop of milk, be it by breastfeeding, be it by bottle feed, anything. But if the milk remains in the mouth for the entire night, that is what is going to cause caries, because milk is sweet. So if something sweet remains in your mouth for the entire night, that is when the bacteria will come and start causing cavity. So it is not nursing which is causing cavity, it is the milk, be it a breastfeed milk or a bottle feed milk. So don't let milk remain in the child's mouth for the entire night. Okay, so why are my child's baby teeth spaced apart? That is a natural setting of your milk teeth. Milk teeth are usually apart. There is space between the milk teeth for some children, there's not. But don't think that if the milk teeth are apart, the permanent will also be like this. No, it's not necessary. Sometimes what happens, because see, they're just 20 milk teeth. So if the jaw size is a little bigger, then those 20 milk teeth will have space in between. So it's nothing to worry about it. Don't think that if the milk teeth have space, the permanent will also have. It doesn't work like that. The permanent teeth are going to be proper. What are the signs of dental problems in babies? Okay, so you can check the teeth if there's a black spot, that is a sign of caries, or you see a swelling and redness of gums, that is a sign of some problem. If the child complains of some tingling or some itching in the teeth, then again that is a sign of a dental problem. So yeah, I think that's you just need to keep checking your child's teeth to see if there's anything abnormal which you can find. When should I start flossing my little one's teeth? Okay, so flossing you need to start only once all the permanent teeth have erupted, because milk teeth, as mentioned earlier, are a little apart, so you don't need to floss for milk teeth. But once your permanent teeth erupts, which is when the child is say 11, 12, 13 years, that's when you need to start flossing regularly. No. So the question is, does my baby need to take fluoride supplements? No, you do not have to take fluoride supplements. Yes, you can definitely give a fluoride toothpaste, which is good. And in India, as a government regulation, the fluoride in the toothpaste is monitored. So every fluoride toothpaste is safe. So yes, you can start giving a fluoride toothpaste to your baby, but you don't have to give any supplements other than the toothpaste. What are the signs my baby has crooked teeth? See, a milk teeth, you cannot, you can't tell if the teeth, if the permanent teeth will be crooked or not, because milk teeth, usually the shape is not very proper. And when the permanent teeth also start erupting initially, when the child is 7, 6, 7, 8 years old, the permanent teeth have just erupted, but the shape is not complete. It is going to take time for the teeth to attain their proper shape. So till the child is 11, 12 years old, you can't say that the teeth are crooked. When all the permanent teeth have erupted and then you feel that, okay, no, the teeth are not aligned properly, that is when you can, go to the orthodontist and get the smile corrected. What should I do if my child has a toothache? Okay, so if your child has a toothache, that is because the caries has, really gone very deep, and that is when you need to go to a dentist and get it checked. Please do not try any home remedies, because it might, the ache might get worse. So please do not try any home remedies. The best you can do is give him a very mild painkiller, probably a ibugesic kit or a half crocin, and or if there's slight swelling in the gums, you can give them lukewarm water with salt and ask them to rinse with it. That is the only thing you should do at home. Then as soon as possible, go to the dentist and get the tooth checked. Are thumb sucking and pacifier harmful for children's teeth? Yes, they are very harmful for, certain, till certain age, say till 3, 4 years old. Thumb sucking is still acceptable, but if the child is doing it post that, it is very harmful, especially when the milk teeth have fallen and the permanent teeth have started coming. Because if the child keeps sucking the thumb, the movement of the permanent teeth is going to be outwards, because that's because of the motion of the thumb sucking. You are kind of guiding the teeth to come out. So the permanent teeth, when they come out, they will not be in a proper shape. So please, you need to make your children stop thumb sucking once he turns 3 years or 4 years old. Post that, it is not good if the child is continuing with thumb sucking or a pacifier. Toothpaste, when should you start using toothpaste? As I mentioned, once your first teeth erupts, you should start using a toothpaste. Since the first eruption, the moment you have your first tooth in the mouth, start using a toothpaste. What should I do to protect my child's teeth during sports events? You can go in for a mouth guard. It is a uniform size mouth guard, very easily available. You can come to the dentist. We customize a mouth guard for you, so the child can wear that mouth guard, because if something hits on the face, the mouth guard takes all the stress. So, and it will help. It kind of protects your teeth. So if your child is into sports, you can definitely get a mouth guard for your child. Can I use an electric toothbrush for my 3-year-old? No. Electric toothbrush is only because electric toothbrush is very technique sensitive. A child will not know how to use an electric toothbrush. So for children, I always recommend to go for manual brushing, because they need to understand the motion of brushing, the round motion. For adults, definitely electric toothbrush is a very good choice, but not for a 3-year-old. No. Okay, so I think we are done with all the questions. If anybody has any question, please feel free to message on, the Baby Chakra platform. And I would like to thank the platform for giving me this opportunity to talk to all of you and answer all your doubts on pediatric dentistry. And a take-home message would be that do not take milk teeth very lightly, because bad milk teeth are going to affect the overall personality and growth and development of your child. So do not take it lightly. Go to the dentist. How you go to your pediatrician? Go to your pediatric dentist also very regularly. And yes, it's going to help your child maintain a very healthy and a very nice smile. So thank you everybody, and hope to see you guys soon.